welcome to Straight Up by edX Live with me, Siddhi Jojare, and here we give you the latest updates from the education sector. The National Medical Commission (NMC) released new guidelines for the Competency-Based Medical Education (CBME) curriculum for the Bachelor of Medicine, Bachelor of Surgery (MBBS) students recently. The guidelines aim to align medical education in India with global standards, focusing on outcome-based learning and so on, and will be implemented from the academic year 2024-25. So what exactly is the CBME curriculum? The curriculum is designed in a way that will build a new generation of Indian medical graduates, IMGs, who are well equipped with the knowledge, skills and education necessary to function as healthcare professionals. These guidelines will be mandated in all medical colleges in India. But the new guidelines haven't gone well with everyone, especially differently abled doctors and medical professionals hailing from the LGBTQIA+ community. But instead of telling you what their issues are, why don't you hear it directly from them? Dr. L Ramakrishnan, the Vice President of an LGBTQIA+ community named SAATHII, he elaborates on why the guidelines could prove to be regressive for healthcare professionals hailing from the LGBTQIA+ community. Listen in.
Recently, the National Medical Commission brought out the 2024 version of their competency-based curriculum for MBBS students. Now, this was the second edition of the competency-based curriculum, the first being the one released in 2019. Even at that time, those of us who follow medical education had pointed out that the competency-based curriculum of 2019 contained a lot of references to the LGBTQIA community that were ignorant and downright homophobic and transphobic. For example, lesbianism considered a sexual offense, gender incongruence described as gender identity disorder, even though the World Health Organization had said it was not so. So between 2019 and 2024, a major incident was that in the Sushma verdict of the Madras High Court, the Honorable Justice Anand Venkatesh had directed the National Medical Commission to revisit the curriculum and purge it of all the homophobic and transphobic content. And in fact, the NMC had issued an advisory saying that the content was to be updated and even shared updates of the forensic medicine and psychiatry curricula, which had been updated to reflect changes in the medical understanding of alternative genders and sexualities, and also the legal understanding and the legal advances in India. So, for example, the same-sex relationships are no longer considered a crime as long as they are engaged in by consenting adults. Unfortunately, this 2024 curriculum reproduces many of the problematic contents in psychiatry and forensic medicine that were there in the 2019 curriculum. For example, in psychiatry, you have a topic called psychosocial and gender identity disorders. The title has been not changed, but there's only one concession where there is a competency stating demonstrate knowledge of medico-legal, societal, ethical and humanitarian principles on dealing with the LGBTQIA community. The rest of it, including the use of the term gender identity disorders, has not changed. Similarly, unnatural offences include sodomy, lesbianism, oral sex, bestiality, etc., which is they're combining consensual and non-consensual acts in this. So, for a student of MBBS who happens to be from the community, all of this really contributes to a feeling of low self-esteem, a feeling that what they are is abnormal, and for this reason, as well as for the reason that we are grooming a new batch of doctors that will go out and practice, and the doctors really need to be clear on the ethics, the medicine and the law pertaining to LGBTQIA issues, and these are sadly lacking in the 2024 curriculum. So both for the benefit of the students of medicine, including those who are queer or trans, as well as for future generations of patients, this curriculum has to be urgently revised and revamped.
Next, we have Dr. Nonita Gangwani, an MBBS and MD degree holder who is currently an assistant professor at the University College of Medical Sciences, UCMS. She shares issues with the guidelines from the perspective of doctors with disabilities. Let us hear it straight from her what she has to say.
NMC has introduced many changes in the CBME curriculum, which was earlier introduced in the year 2019. The major limitation or the drawback has been for the persons with disabilities, because like me, I am an assistant professor and I had been teaching disability competencies to the medical students in their foundation course for a dedicated set of 7 to 8 hours. Now I no longer would be able to do it. This competency, like, it was actually helping the students learn how to communicate with the person with disability, which language to use. Now again, this will set us send us again on a back seat, because now again we won't be able to tell them or teach them how to communicate, like understand what the person might be going to. So there will be a lack of development of a compassionate doctor.
That was all we had for you today. What are your thoughts on these new guidelines? Tell us in the comment section below. For more such education related news, stay tuned to edX Live.